This is Transmission Interrupted, the podcast series from NETEC, the National Emerging Special Pathogens Training and Education Center. Welcome to Transmission Interrupted from NETEC.
Hello, and welcome to Transmission Interrupted. My name is Jill Morgan, and I'm an ICU nurse here at Emory University Hospital in Atlanta, Georgia. For those of you not yet familiar with NETEC, our mission is to increase the capability of the United States public health and healthcare system to safely and effectively manage individuals with suspected and confirmed special pathogens in cooperation with the CDC and funded by ASPR, the Assistant Secretary for Preparedness and Response. On today's episode, we're going to talk about one of my favorite topics, personal protective equipment. I became passionate about PPE when my home facility was asked to care for an Ebola patient, and I realized how little I knew about these pieces and parts and processes that were supposed to protect me. But today, I'm very happy to have with me Carly Snider from Nebraska, and we're going to talk about a different group of people who need protection, the staff at long-term care facilities. And we mean anyone who works in assisted living, skilled nursing, nursing homes, or residential care facilities. So thanks for joining us, and let's get started with this episode of Transmission Interrupted. NETEC has you covered, PPE for long-term care. Carly, tell everybody a little bit about yourself.
Well, first of all, thanks, Jill, for having me. I'm just as excited about PPE as you are, so I guess it's good we're on this together. I am actually a community nurse here in Omaha, Nebraska. I work at an assisted living and memory care called House of Hope Alzheimer's Care. We also have House of Hope Assisted Living and Royal Oaks Assisted Living. We are a nonprofit organization that primarily serves seniors 65 plus, and we also have a sister company called Florence Home Skilled Nursing and Rehab. So I'm really excited to be a part of NETEC as a subject matter expert and to be here today to share my knowledge and expertise with others.
We know that PPE may not be everyone's favorite topic. We're just special that way. But it is a topic that we think doesn't get enough attention. People assume it's easy or that it's obvious or what you use or how you use it is just known intuitively or that you learned it in school. But none of that's really true. And while people think that things like needle sticks are the biggest risk from an infection standpoint that healthcare workers have, over 3,000 healthcare workers acquire tuberculosis at work each year. And there are an awful lot of other infectious diseases we don't want it for ourselves or to carry home to our families, whether that's influenza or RSV or a herpes virus like shingles or chickenpox, CMV, MRSA, and now COVID. So healthcare workers in long-term care are delivering care and putting themselves in close contact with all sorts of infectious diseases that don't need a needle stick to make us sick. And that's where PPE comes in. This resource is for any time you need PPE, not just for COVID. Carly and a group of other long-term care experts have helped us put together a guide for PPE that is specifically aimed at all of the various people that need protection in all of the various settings that the long-term care term encompasses. And you can find the link to that resource in the show notes for this episode.
Yes, we have a great team that has developed a new and easy way to follow education. It's a resource about basically everything PPE. And we really built this resource keeping long-term care communities in mind, such as assisted living, like where I get to work, skilled nursing and rehabs, home care, and even hospice services. This resource breaks down everything PPE from your basic knowledge to the chain of infection. We provide examples of PPE, how to train the trainer, and my favorite, the expert tips.
Carly, tell me how you've made this work in your facility. Who did you need to convince or who do you have to get buy-in from in order to put this into action?
Jill, honestly, it really didn't take a whole lot of convincing. I was able to help build this PPE resource and I really believe in it. So I brought it to the attention of my boss at my community and also to the attention of our company's CEO, and voila, they loved it. and made it into a mandatory training for all of our staff in all areas. And when I mean all staff, I'm including your receptionist, your maintenance crew, dietary, obviously nursing, your CNAs, your med aides, and your nurses, housekeep, and even management and administration. It is part of everyone's training in our communities, including our new hires. It's easy to follow. You can use it in a variety of ways. You can even access it online for education and training purposes, or you can even print it off and use it in a training manual.
Yeah, we absolutely understand that some folks are saying, why now? I've been using PPE for years. What new is there for you to tell me? But we think that this is the perfect time, that we finally have the time to get this right. No one's job should make them sick. We want every worker in long term care to know when and how and what to use to protect themselves. And that might mean that we need to unlearn and relearn. We may have developed some bad habits or some sloppy habits, things that can compromise our clothing, our hands, or the environment we work in. It's important to understand that the methods and the habits and the processes around PPE are just as important as the items you're provided with. So our PPE, when used correctly, reduces the chance that we move these infectious diseases around, like around our facility, to our computers, to our nurses' stations and break rooms, but also to our clothes and our cars and our families. And these are risks that we can't see, right? One study looked at people caring for folks with like a respiratory illness, sound familiar? And found that when they took their PPE off, 31% of their gloves had that virus on it. 21% of their isolation gowns had virus on it. And 12% of their face masks had this active virus from the patient that they were just caring for on them. So it's really important that you know how to take those pieces off and leave those germs where they belong. We don't want you to be that person that carries it around and potentially contaminates your workplace or brings something home to your family.
I agree 100%. I really feel like PPE is just as important now as it was before. We've always had PPE around, but really, you can say over the last year, year and a half, especially in long term care communities, we're using more PPE than we probably ever have before, especially more types. We're used to using gloves on a daily basis, but who would ever heard of really wearing goggles or face shields and gowns on the regular, right? In assisted living situations. As we're using it more, it's become an everyday staple in our lives in healthcare. And I feel that we've been seeing staff in all different situations and scenarios becoming more complacent, maybe not being as diligent with their PPE because they're getting burnout or they're tired of wearing it, or maybe they don't even know how to wear it properly. So we really need to approach it from a team effort, really lead by example, training the trainers, training your staff, and then comping them out, being there in the situation that's occurring and observing it in action. And if somebody improperly removes their gloves, step in right there and say, can I show you this might be the proper way to do this? And our resource will show you and help teach you how to do that.
Yeah, I think it's a really good point that with this increased use of PPE, across the country, mask use, hand hygiene, people carrying hand sanitizer with them, all the things that have been put in place in the last year and a half. We've actually seen a tremendous decrease in a lot of other respiratory viruses as well. Carly, as we head into sort of Thanksgiving and right now, big holiday season, do you have any special concerns like about the safety of long-term care staff right now?
I know a lot of us are excited about the holidays coming up, and most of us in the long term care world, we're open to visitation, which is absolutely awesome for our residents and for families. And it's really important to educate our staff in all of these settings about the proper PPE use, including hand hygiene. During the holidays, we know there's plenty of parties and gathering and family and friends visiting, which, if you're like me, I'm a hugger. I love to hug my family and friends, and I love to hug my residents, and they love to hug and be in close proximity, especially those that maybe haven't had an opportunity to see their loved ones in a while, right? This may be the one time a year where they've actually going to be able to see them. And so we want to make sure that that happens, but we also want to make sure that they're safe. We may not always know who we come into contact with or who they've been around, what they've potentially been exposed to. And so it's really important for our communities to know the proper steps to take to protect their staff, as well as the visitors and family members and friends that come in. And we want to be able to enjoy the holidays with those we share it with, but we can also remain safe and protect ourselves and others.
Carly, you've clearly made this work in your workplace. And I know that I came to be a PPE true believer through Ebola. Tell me why you went to all this trouble and how you got to be such an enthusiastic supporter of PPE.
Well, my role as community nurse and assisted living has been nothing but evolving, especially over the last year and a half when we heard that term COVID, right? And I just know from experience in all my years of nursing that education and training is so important, not only for your nursing staff, right? It takes the community. You really need to teach and train and educate your staff as a whole. And we all care about each and every one of our residents and our staff members and their family members and visitors. And working in a community, we're working with vulnerable adults, including those that may have cognition or a memory impairment of some kind. So it's really imperative that all staff know the proper way to don and doff and handle PPE safely, from everyday use to if you have an outbreak or an illness come about. This PPE resource can really be used as an educational tool and a training guide. It's easy to read and follow, easy to understand and share. We have implemented pictures, things like do's and don'ts, proper donning and doffing of your masks and gowns and gloves, how to train the trainer, and one of my favorites, the expert tips. So it's truly a great resource that can be used by anyone that's working with PPE. So this may mean it's staff or volunteers, even family members could utilize this resource. And our team that is working with NETEC continues to build and expand on other projects to help to continue those working in long-term care communities and services. So stay tuned for more.
I think that's great. And I think you're right that when many people think about the U.S. healthcare system, sometimes long-term care isn't part of what they think about. We really want to bring it back into the fold and understand that an awful lot of care is delivered in these situations. We hope that you will do whatever it takes to keep yourself safe, to know what and when and how to use PPE correctly so that any of the icky stuff you encounter doesn't go home with you. All of you in long-term care are doing hard, exhausting, and frustrating work. It shouldn't be dangerous as well. Thank you so much, Carly, for joining us today to discuss PPE in long-term care. And please, we hope you'll check out the show notes for the link to the PPE resource that Carly and her group put together and that we've been talking about today.
I appreciate you guys having me, and thank you so much. PPE really is an important topic that's affecting all of us in healthcare and in long-term care. And I really hope everybody that tunes in has learned a little bit more today about this great resource, and they will consider checking it out, sharing it. And long-term care communities, we got this, and all the surrounding services around us. Use this resource, please.
So you can check the show notes for the link to this PPE resource we've talked about today, as well as some other references. Thank you so much for tuning into this episode. We hope you'll join us for future episodes on a wide range of topics, from healthcare worker safety, personal protective equipment, and more about infectious diseases of all kinds. If you have any questions for us or ideas for future shows, please contact us at info@netec.org, or you can find us on the web at netec.org/podcast, where you can subscribe to future episodes and find more information on today's topic. We hope to see you next time on Transmission Interrupted.
You've been listening to Transmission Interrupted, the podcast series from NETEC, the National Emerging Special Pathogens Training and Education Center. Learn more at netec.org.